Okay, so wait a minute. Let me get this clear, Kirby. My son just broke his leg. It was a compound fracture, so probably something you couldn't take care of in your office because he did need surgery. His x-ray was $424. You're telling me you can get an x-ray for $40?
$40 and with the radiologist read on top of it, and we can order stat x-rays. There's even, like I said, after weekend hours too, there's a bridge weekend hours, so even if it was a Saturday morning soccer game, we could be able to get some answers that day rather than having to sit on a break for 2 or 3 days.
Wow, this just needs to be exposed. I mean, people they're just so used to thinking healthcare is expensive. And really, until Janet and I started engaging in this and educating ourselves, we didn't know much different. And working with practitioners like yourself, we've been educated that, it doesn't have to be expensive. My son's $424 x-ray didn't include the $50 x-ray reading or the radiologist reading it. That there was another fee on top of that. $40 is under 1/10 what we were charged at a local hospital. So definitely something that needs to be exposed because that's just got to stop. Here's what people don't understand either is that nobody really pays that price because there's a negotiated price with an insurance company and they won't pay that price. So why should a cash paying person pay that price?
Yeah, that's a big conflict that a lot of people are having, is that you have this big fat bill, but you're only paying a portion of it. Well, how is the insurance negotiating these rates, or what are these companies doing to either artificially inflate rates so they can say, hey, I'm going to charge $300 more, but I'll give you a $270 discount, so it looks like I'm giving you a discount. When in fact, we just need to know what the actual cost of the supply, of the facility, of the procedure, of the whatever it is. We just need to know what that costs. And transparency is tough. You think about it, you go to the mechanic and say, hey, I want my oil change. Well, that's going to depend on a prior authorization and could range from $25 to $450 depending on what. It doesn't make sense.
No, right. It doesn't. It's the only industry like that. That's one of the things that our goal is on this podcast, is just to educate and empower consumers that they are in charge of their own healthcare, and that includes their healthcare pricing.